So it's the time to start the international session. Today is the 1781st day of uninterrupted daily webinar of IFPH. Before beginning the session, let's have a silent prayer. Hello, doctors, friends of homeopathy and students of homeopathy. Today, the 1781st day of uninterrupted daily webinar is beginning. Today, our guest is Prof.Dr BIBHU PRASAD PANDA, Professor and Campus Director, Rajkot Homeopathic Medical College, Rajkot, former Principal and Hospital Superintendent, Parul Institute of Homeopathy and Research Hospital, Vadodara. He do have a professional and teaching experience of 32 years. He is a great academician, trainer, administrator. He adorned various institutions. And today's our topic is homeopathy and women's health, hormonal balance from puberty to menopause. Let's welcome Dr. BIBHU PRASAD PANDA, and I welcome you all for the session.
I also welcome Dr. BIBHU Prasad. After seeing you after a long time, I am seeing you. I had been to Baroda and you have taken a good hospitality. Thank you very much. And I know that you are one of the wonderful persons of the Parul University. So start your session now, sir.
So thank you, Bindurajji and Sahani sir. I am very happy that the International Forum for Promotion of Homeopathy continuously delivering different webinars in different topics and enrich our faculty and all the students. So regularly I am seeing this webinar, I am participating in this webinar. We are inviting so many professors, doctors and eminent personality of our fraternity, and we are able to sharing our views by which we are able to increase our knowledge and sharing all the things in different topics also. So let me open my, is it visible, sir?
Yeah, it's buffering. It's about to start.
Is it visible, sir?
Yeah, it's now visible.
So, has already been spoken that Jatra Narishu Pujjate Tatra Tishtanti Devata, where the ladies are worshipped, there the god comes. So, in homeopathy, we have having a great scope to treat different types of diseases relevant to women. And the topic which is given to me, that is homeopathy, women's health, hormonal balance from puberty to menopause. That can be called gentle healing for every stage of womanhood. So different hormones play roles for different changes in puberty, in childbearing stage, in menopause, and our homeopathy, by its dynamic action, it balances equilibrium, establish equilibrium between the hormones, because you know that in our body, the controlling system, that is CNS, central nervous system, peripheral nervous system, and hormones. And they control every activities of our body. Likewise, in female also, these activities which changes from puberty to menopause, they are controlled by different hormone. And in this session, we'll discuss the importance of hormonal balance in women's health, challenges across different life stages, how homeopathy offers a holistic solution. So in Hindi session, Dr. Sahani was nicely presented that how the diseases of different diseases can be treated successfully by our holistic medicines, which are obviously found in rainy season. So now let us discuss about the hormonal changes, because all the hormonal changes, they are nicely controlled by God-given hypothalamic pituitary ovarian axis. So hypothalamus belongs to brain, Then pituitary gland again that is located in the brain, and ovary that is located in the female genital organs. So some hormones they are secreted from hypothalamus, some hormones they are secreted from pituitary gland, and others are from ovary. So and even some hormones they are also secreted from placenta also. So we'll discuss how these hormones they to balance and maintain proper stages in different phases, and how our homeopathy help to maintain equilibrium. And before that, let us see the different parts of female reproductive organ. And in this reproductive organ, ovary, uterus, cervix, vagina, clitoris, labium major, labium minor, and the pathogenic gland. So many we have already studied in your anatomy. And the journey from menstruation to menopause, it beginnings 11 to 12 years, the puberty starts. Puberty is otherwise called as menarche, and the menses starts. It depends on the nutrition of the female, and that's why there is a variation. If the girl is getting good nutrition, then it may start in 11, or it continue to 12 years. If it will be late, then it can be considered as late puberty because of some reason. We'll discuss later on about our homeopathic medicine. Then the fertile period, the range is 12 to 50 years. Then after 50 years, the menses stops, the ovulation stops, and menopause starts. So then let us come to the next, that what are the hormonal milestone in a woman life and homeopathic support. In puberty, the range I have already told. Hormonal changes, rise in estrogen and progesterone. So estrogen is the hormone which helps to to go from the girl stage to woman stage. So all the development, it depends on estrogen. It is the main and prime hormone which play a role. And when the estrogen level decreases, then the puberty delayed, irregular periods occurs. Even in menopause, because of the estrogen, zero estrogen, all the mood changes, etc., that occurs. So common issue in the less of estrogen, that is delayed puberty, irregular periods. In the reproductive years, that is between 15 to 45 years. So common results, polycystic ovarian syndrome, then dysmenorrhea, premenstrual syndrome, infertility. So these are different disorders occur because of hormonal changes. And in pregnancy and postmortem also, the hormonal influence, especially to maintain the present pregnancy, progesterone, estrogen, human chorionic gonadotropin hormone, which is secreted from the placenta, that helps to increase the secretion of estrogen, and prolactin that is secreted from the pituitary. And common complaints, morning sickness, depression, these are occurs during the first trimester. There are 3 trimesters, everybody knows. So premenopause and menopause, premenopause and menopause, that the variation age is 45 to 55 years. The menses stops after 12 continue months. If the menstruation will not appear, then and different symptoms correlated with it, then it is considered as menopause. So during menopause, hot flashes, night sweats, mood swings, these are different symptoms which appears, and we are having several medicine. We'll discuss one after another. So this is the hormonal regulation in female. The hormones which are secreted from brain, so that is gonadotropic hormone, which is secreted, gonadotropic releasing hormone, that is secreted from hypothalamus. And in pituitary, there are 2 hormones. One is follicular stimulating hormone, another is luteinizing hormone. And ovary, that is from ovary, the estrogen, progesterone, these are the hormones which are secreted. So these are the chain that is that plays role from puberty to menopause, total period. Then we will need to understand that what are the hormones which play role in puberty, and if the hormone will be less or the hormone will be more, then what will be the consequence and how will you manage homeopathically. Let us discuss that regarding the miasmatic diagnosis and regarding the medicine. We should nowadays, the scientific mind, they want to know that how homeopathic medicine act. Though Hahnemann has told that we should try for the result, not go how the disease occurs. But we have to, nowadays we have to prove that how our homeopathic medicine works and what miasm plays the role. So if we'll consider the germinal stages, that is ectoderm, endoderm, and mesoderm. So ectoderm, the superficial skin, and even the vaginal superficial layer of the vagina. Then that is whatever the disease that occurs in that area, then the miasm is Shora, because all the diseases which appears in superficial layer, Shora is responsible, and functional disturbance is for some functional disturbance, Shora is responsible. For epithelial layer, endoderm, so whatever disease that will be developed from endoderm, then we have to treat them by syphilis, and mesoderm, that is your psychosis. So if there will be any growth like fibroid, a cyst, so that comes under psychotic miasm. So, but we should not treat therapeutically. We should take the totality. Even mental symptoms bears more value, and rather in physical diseases, mental symptoms has more value. So we have to form the totality by considering the physical symptoms and mental symptoms, and specifically we should consider the uncommon peculiar symptom. We have to form the portrait. Then you have to consider the imaging as a objective symptoms. You have to consider the investigation report. So everything should be considered, and then the medicine should be chosen. So one after another I will discuss. So why homeopathic for women? It is here individualized treatment is done. We are not giving medicine like allopathy or Ayurveda or any other system for each and every person. The same medicine is prescribed in same power, not like that, because our system is based on individual concept. So a case may require pulsatilla in one patient. In same case, pulsatilla may not be the similar, because the totality must cover all the symptoms which are found in the patient. As for example, in pulsatilla, it has been written that if the girl is not since puberty, if the complaint arises in puberty, whatever may be the complaint, then if the mother will complain that my girl was very well before puberty, before appearance of the menses, but after the appearance of the menses, after appearance of the secondary sexual organs, every complaint that comes. So pulsatilla is the indicated medicine. So pulsat, but what I'm telling, so always blindly with prejudice, we can't prescribe pulsatilla. So we have to look after the cause, because in homeopathy we have to consider the cause, we have to consider the world of thought, we have to consider the process, we have to consider the beginning. So if we consider the world of thought, then automatically the world of matter will be removed. If we consider the process, then the product will be removed. If we consider the beginning, then the end, there will be no end. So in this way, so we have to consider, for example, a girl, there is delayed puberty because she was suffering from anemia and not getting nutrition. So you have to give supplement. If you give medicine then it cannot help, because that is not because of want of assimilation, but because of want of supply. So if the girl is getting good nutrition and there is no deficiency, then we should consider that is because that may be because of want of assimilation, then silicea may be prescribed. So silicea, again, the medicine which should be prescribed, it should be prescribed in proper potency, proper repetition should be there. But silicea cannot be the medicine in all cases. So we have to find out the cause, If the cause is deficiency, want of food, then you have to give supplement. Then again, for better assimilation, you can give medicine. And that's why every physician must have knowledge about the disease, because the knowledge of diagnosis helps us to manage the case. By prescribing nutrition, you can know the prognosis, the consequence. So to know the consequence, we have thorough knowledge about diagnosis, and if you know the consequence, then you can able to counsel the patient that this is the problem. Another example I am giving: suppose there is underdeveloped breast, so we have having the medicine Sabal Cellulota. So Sabal Cellulota is the medicine where the breast has not developed. So in these are the pivotal problem. If you prescribe Sabal Cellulota, it will work. I am not telling that because it is a organopathic medicine. On the basis of organ, we are prescribing the medicine, like your chelidonium for liver, like your cyananthus for spleen, like your Sabal Cellulota for prostatic enlargement. So these are some organopathic medicine can be prescribed. But what as Sahani Sahab told in Hindi session, that organopathic medicine is not the individualized medicine. It cannot cover the totality. We have to take the totality and we have to give a simillimum to get a result. So always we have to emphasize the individual features. And homeopathy has no side effect. Yes, homeopathy, why there is no side effect? Because homeopathy minimum dose is prescribed and it acts through sentient and nerve endings. It acts directly in the target organ. It will not do any harm to the surrounding organs. So this is the benefit. And because of minimum dose, if the medicine is wrong, then the medicinal aggravation will be too less. And even in 6th edition of organon, Dr. Hahnemann has introduced the 50 millismol scale, where the dose is so minimum, then the homeopathic aggravation will be very minor. So it can be managed properly. So there is no side effect, and then it support the body and mind balance. In other system, I will discuss later on that what is the demerits of hormonal replacement, hormonal supplementation. But here we are not giving hormone. Our medicine has no material quantity inside it. So you all know that after 12C or 24X, there is no material quantity inside the medicine. So if there will be, it will affect in dynamic field. It through neurotransmitters. That's why there will be no adverse effect. And again, we are considering the body as a whole. Though there is imbalance in the hormone and it causes delayed puberty, it causes difficult menstruation. But we are not considering it only. We are considering the tendency, the mental activity of the patient, and physical mental changes, whatever appears after the disease, we are considering it. That's why, because of holistic application, it also helps to change, also balance the body as well as the mind. And it is very safe during pregnancy and lactation. So in lactation, even the mother can be administered, the medicine can be administered to the mother, and it will affect the baby. And during pregnancy, rather in pregnancy, the sensitiveness of the female is more. The female is more susceptible to receive the medicinal force. So if it will give, the double benefit will be there. It will help the mother to cure. For example, during pregnancy, cough appears. In Boric Mathematica, it has been clearly written that if dry cough appears during pregnancy, then Conaim is the medicine. So Conaim must be prescribed. So when the medicine is prescribed to the mother, if it is constitutional, if it is miasmatic, then it will benefit to the offspring also. So the offspring will be benefited because the umbilical circulation, the fetal circulation is there. Through circulation, the medicinal power will go to the fetus, and the fetus will be benefited. So this is the benefit of our homeopathy. So then the next puberty and homeopathy. In puberty, there are different. I will discuss some symptoms and some cases. Puberty changes. What happens there? There is during menarche. What happens? The girl feels because of secretion of different hormones which are protein in nature. So many mood of swing or awkwardness they will appear. So that can be treated properly by homeopathic medicine. And if it is slow, that means the puberty change which is not appearing properly, then calcarea phos is one of the best medicine. So again, I have already explained that if the girl is not since puberty, pulsatilla is the best medicine. And calcarea phos, if the growth of the girl is not well, and if the girl, the constitution of the girl is like calcarea phos, that means there is a big head, and the development is not well. There is the abdomen is like saucer, and everything, and there is lionteria or undigested digestion problem is there, and the development is bone is not up to the mark. Then calcarea phos is the best medicine. Slow in dried and wrinkled girls. So there are so many medicine for during puberty. Even calcarea can be prescribed. So if the baby is fair, fatty, flabby, constitutional medicine, as a constitutional medicine, you can prescribe your calcarea for delayed puberty. And puberty, in puberty, what happens there? There may be amenorrhea. So amenorrhea, I am not discussing about the physiological amenorrhea. So physiological amenorrhea which occurs after the after pregnancy, lactation, I will discuss later. But during puberty, what happens there? The menses may not appear in proper age. So if menses is not appear proper age, that means after 12, if the menses is not appearing, then these are some medicines: Agnus castus, then Senecio aureus, pulsatilla. But we can't prescribe medicine blindly. We have to take the totality, and we have to consider rather in physical complaints, the mental symptoms bears more value. So if you take only the physical symptoms, you will not cover the mental symptoms, then it will be palliative medicine. So we have to consider, for example, pulsatilla. The girl must be looking beautiful, then mild yielding disposition, and then there is mood changes, crying, weeping in any disposition, cannot relate or complain without weeping. Then there is changeability is well marked. So, and a fear of opposite sex. So if these are the symptoms are present, then you can prescribe pulsatilla. And pulsatilla is also a very good medicine which can cure the development faulty development of gonad. And then the causation getting fit weight, nervous debility, and chlorosis. So always we have to consider the sign symptoms, both the symptoms of mind as well as body, and the constitution should be considered. If the constitution of the baby is lean, thin, and then very weak, bone are weak, then calcarea phos may be given. So on the basis of totality, we can prescribe the medicines during puberty. So if you prescribe, if you supplement, give a hormonal replacement will be there, then it at having adverse effect. What are the adverse effect we will get? So there will be bloating, nausea, breast swelling, tenderness, mood changes, headache, vaginal bleeding. So these are different hormonal effect, adverse effect of hormone. So hormone supplement is not the way to establish a normal menstruation. Rather, it may disturb if the quantity of the hormone will be not proper. The effect will be rather dangerous. So homeopathy can replace the hormonal therapy, and it act as a stimulant. What our medicine do, if we consider in dynamic plane, our body body, mind, and soul, these are the trinity of life. So the soul, that means vital force, controls all the organism in harmonious manner. So from center to periphery, it is a centrifugal force. By means of influx, it supply energy to different part of the organs and make it balance. So it stimulate, it act as a stimulate. We are giving minimum medicine. Actually, vital force does everything. What we does, what our minimum dose, how it works, it produces least possible excitation in the vital force, by which the vital force will act in the normal way and balance, and it establish the balance between body and mind, and health is restored. So then puberty and adolescence issues generally akin irregular menses, mood swings. So these are the medicines which I have already discussed: pulsatilla, sepia, calculator. But we have to give trace on mental mental symptoms. For example, sepia, telltale face is there. In sepia, what is there? That indifference to the nearest and dearest. The girl cannot do not want to discuss anything with anybody else. So this type of mentality will get in sepia. Then calculator, the constitution is more important. There is leukophlegmatic constitution, fair, fatty, flabby look, and there is sweating from back of the neck. So these are the symptoms we have to look after, and accordingly we have to prescribe a medicine to establish to remove the imbalance and make it regularize. Then reproductive years, it starts from 20 to 20 to 30, 40. So there are so many in reproductive years. What happens there? The menstrual disturbances, life, because of lifestyle, because of irregular habits. So the and because of taking so many cosmetic, etc. These things occur. So in our gynec, we have studied so many things. For example, menorrhagia, leukorrhea, metrorrhagia. Then our what I'm telling, that is dysmenorrhea. So these things occurs in reproductive years. So for those, we are having so many medicines. The question is how our medicine works. For example, I am telling about dysmenorrhea. So dysmenorrhea means painful menstruation. So painful menstruation. So that is because of there are two type of dysmenorrhea: congestive dysmenorrhea, spasmodic dysmenorrhea. So because of the contraction, it occurs. So we have having medicine. You should know the how our medicine works also. For example, I'm giving example that is hourglass contraction. Hourglass contraction, that is a false contraction occurred during delivery. So during delivery, what happens there? The contraction must be continue to deliver the baby. But if the contraction will be not continue, then the delivery will not progress, and in that phase, in allopathy, they are injecting oxytocin. So oxytocin produce contraction. But we have having good medicine. We have having for hourglass contraction, our belladonna is a very good medicine. Colophylum is a very good medicine. So there is no need of any hormonal hormones. And if you prescribe this medicine, it act in better manner. So I have myself, I have observed so many cases in childbearing phase, that if there will be less secretion, if there will be no milk production during after the birth of the child, it is very difficult issue. But it can be managed homeopathy in nice manner. So I have seen the Ricinus communis in Boric Mathematica. It has been clearly mentioned that Ricinus communis 30, 5 drops thrice daily, if it will be given, so within 1 or 2 days, the milk production starts. So it is a miracle. We can, I have seen in so many cases, and without thinking anything, I am prescribing this medicine. Second thing, to dry up the milk. Suppose the child dies, then it requires to dry up the milk. Otherwise, what will happen? That it leads to mastitis. So to dry up the milk, our medicine, that is lacaninum. It is a very good medicine to dry up the milk. So in reproductive years, what is happening? After marriage, the lady wants to get a child. So we are having good medicine for sterility, for impotency in case of male, and for sterility in case of female. Simple ear medicine, that is borax. Borax is very good medicine for sterility in women, because the vaginal secretion, it has been written in Boric Mathematica, for vaginal secretion, if it is spermicidal, then borax is the medicine. So, but what we should need always, again and again, I am telling that we have to take the totality. If you are prescribing a therapeutic medicine, therapeutically organopathic medicine, it should be followed by constitutional or miasmatic medicine on the basis of history. If there is history of bad effect of vaccination, if there will be history of abortion, we are having so many medicine, 3-month abortion, ectiaracimosa is the medicine, colophyllum is the medicine, then other medicines are also there to prevent abortion. Viburnum opulus is the medicine. So this medicine, as per the totality is concerned, we can prescribe to prevent abortion, and this knowledge we should have. I should know about the type of abortion also. Dysmenorrhea, these are the medicine I have mentioned here, and I have collected from different books. So viburnum opulus, membranous spasmodic dysmenorrhea with cramp in thigh, extending to cuff. Yes. So again, we should know about the type of bleeding. As in ectiaracimosa or simicifuga, it has been written, more the bleeding, more the pain. All the pain ceases after bleeding. Lacacy, zincometallicum, these are the medicine. So correct data, correct case taking should be there. But after the pain is over, for example, we are prescribing a medicine and the pain is over. So after over, then you have to prescribe when the patient is in well condition. Constitutional medicine need to be prescribed to prevent the recurrence again. Then it will be good for the health of the child, health of the girl also. For example, there is pain, dysmenorrhea, where the pain travels from sacrum to pelvis and partly clotted, partly fluid. This type of bleeding is there. So sabina is the medicine. Definitely. So sabina is the medicine. So in proper potency, we can stop this type of problem. We can cure such type of problem. But after curing, we have to go for constitutional medicine to enrich the soil, because disease grows in the soil. So we have to enrich the soil by prescribing constitutional medicine. If the girl is having sepia constitution, she is like lady. That means narrow pelvis and telltale face and indifferent to the nearer and dearer, then you have to give sepia to prevent the recurrence of this type of problem, dysmenorrhea, in future. So these things must be considered. And there are n number of medicine for dysmenorrhea. Magnesiophos is the medicine for dysmenorrhea. Belladonna is the medicine for dysmenorrhea. But these are the medicine which can be prescribed in acute episodic attack. So acute episodic attack, whenever the problem is more, it looks like acute disease. So they can be divided into 4 parts. Acute disease appears during chronic treatment. Acute episodic attack, like epilepsy, like your dysmenorrhea during menses, and then your acute disease, acute exacerbation of chronic disease. A person who is suffering from asthma, and the person exposure to dry west wind and the asthmatic condition aggravates. Northwest wind, equinite can be prescribed. After that, the chronic medicine can be given. So we should have thorough knowledge about acute exacerbation, acute episodic attack, acute disease appear during chronic treatment. Yes, then the diet, yes, there is role of yoga and exercise also. So then for menorrhagia, iodine can be, yes. Whenever we are consider iodine, then you have to look after the thermal reaction of the lady. That means all the medicine where iodine is there, that person is hot patient. So the person must be hot. If it is not hot, then iodine is not indicated. For example, a girl having neat and clean nature and gay like April day, sipping water is there, and fear of death, and the girl tell there is no need of medicine, I will die. Such type of mentality is there. Then arsenic is indicated. But if the child, if the lady or girl is not chilly, hot, then arsenic is not indicated in medicine. Arsenic iodide can be prescribed. So that is called synthetic prescribing. So we have to consider the holistic view of that patient, and we can prescribe the medicine accordingly. Phosphorus is a very good medicine for menorrhagia. Yes, for menorrhagia, there are many medicines, but where phosphorus is indicated, there must be tubercular diathesis. Then the constitution of phosphorus, long slender girl, narrow chest, and wants to be magnetism. So these are the symptoms must be there. Yes, for pelvic diseases, in pelvic inflammatory disease. Yes, from belladonna to belladonna to sepia, sabina, any medicine can prescribe, but other symptom must be correlated, and again the potency must be correct. Potency must be selected on the basis of susceptibility of the patient. For example, as potency selected, we have already studied that the age is inversely proportional to potency. When the age increases, the potency must be decreased. That means in the age of 20, the potency, and the age of 60, the potency, in the age of 60, the potency should be low. But we should understand about the contradiction. In developing stage, the potency is always high. Example, a girl of 9 years required potency 30, but a girl of 12 years required potency 200. Here there is contradiction, because that is the puberty age, and that is all the hormones they are secreting. That's why the sensitivity of the girl is high. We have to give higher potency. So potency, we have to fulfill the three conditions. Number one, which has been written in 246 aphorism by Hahnemann. What are those three conditions? Number one condition, that is similimum. So we have to select a medicine which is similar in all respect. Second condition we have to fulfill, that is dose and potency. The dose and potency, dose must be minimum. Potency must be selected on the basis of susceptibility, nature of the patient, nature of the medicine. Then third one, repetition. If the medicine is correct, dose potency is correct, but we are not repeating the medicine in proper manner, then also you will fail. So you have to repeat medicine. Suppose a person is suffering from any disease that is high fever. So in high fever, we can give medicine arsenic or belladonna or ferramphos in 2 hours interval. So when the patient gets relief, then you can in lengthier the duration of the interval. But as per the suffering is concerned, you have to repeat. So three conditions must be fulfilled. Number one, similimum. Number two, dose and potency. Number three, repetition. So this concept should be followed in the treatment of the cases during reproductive periods also. So during reproductive period, childbearing age periods, again during we'll discuss about pregnancy, what are the diseases and disorder occurs. But in the reproductive phase, leukorrhea is a complaint that nowadays it is prevailing. So leukorrhea, so it has been written that leukorrhea is caused by Trichomonas vaginalis, but that is not the only cause. So that the white discharge that occurs because of the oversecretion of batholian glands also. Even in child, leukorrhea occurs when the pinworm, they comes outside the anus, enter it inside the vagina, irritate the batholian glands, then the discharge, that is also leukorrhea. So for that, sepia, calcarea carb, these are the medicine. But leukorrhea, we have to find out the cause. As I have already discussed, that we have to find out the cause. We have to find out the beginning. So alumina, local and systematic cause of leukorrhea. Even graphite is when leukorrhea gushes day and night. So when the leukorrhea gushes day and night, alumina is graphite is the medicine. Borax, leukorrhea before and after 10 days. Conaium is the also medicine. So these are the symptoms, and simultaneously we have to correlate it with constitution and your mental symptoms also, because leukorrhea is the product. So that is the end product. So to stop the end product, we have to come to the cause, that is the beginning. So if the leukorrhea is because of unhygienic condition, then accordingly we have to take the steps. So Creosotum corrosive leukorrhea, it corrodes the genitalia due to poor health in general and poor personal hygiene and anemia. So it leads to leukorrhea. Natriumur, then silicea. So these are some medicines for leukorrhea. Then metrorrhagia, metrorrhagia, intermenstrual bleeding. So the physician must have thorough knowledge about different perspective of metrorrhagia. Metrorrhagia in aged may be a symptom of what I am telling, that is cervical cancer. So and metrorrhagia, the intermenstrual bleeding may occur. So we have having so many medicines. For example, erigeron. So I have not mentioned here metrorrhagia. So plumbum metallicum, metrorrhagia due to incomplete abortion. So when the abortion is not complete, then the medicine plumbum metallicum is indicated, and it leads to leukorrhea. Trillium pendulum is the medicine active uterine hemorrhage after hormonal imbalance. If there will be hormonal imbalance, for example, during puberty, the estrogen progesterone secretion is more, but day by day towards menopause it becomes negligible. So if there will be hormonal imbalance, estrogen level decreases. Even in menopausal period, the thickness of the vaginal wall decreases. The protection of the vagina cannot be occurred. So the lady will suffer from pruritus. The lady will suffer from different bacterial infection. So that's why what the gynecologists they do, they used to give supplement. Estrogen therapy is done. Even estrogen jelly is applied. We have having medicine for dry vagina, that is natriumur. But if the cause is hormonal imbalance, then of course our natriumur will work. What natriumur does, it will stimulate. It will stimulate. For example, here for estrogen secretion, the instruction comes from hypothalamus. Then then from your pituitary, follicular stimulating hormone, and the other hormone, that is luteinizing hormone, they are secreted. Then in ovary, the other two hormones, progesterone and estrogen, they are secreted. So in reverse, when the follicles mature, the ova comes outside the corpus. From the corpus luteum, the progesterone is secreted. So there is a hormonal chain. So our medicine, it stimulates the gland, and by which the gland is stimulated and the level of hormone increases and the hormonal balance established. Then again, pruritus vulva, that is a common symptom. Even it occurs in puberty, even it occurs in reproductive age and menopausal, in menopause also. So pruritus vulva, yes, bleaching of the vulva. So in caladium it has been mentioned that you take 1:12% hydrogen peroxide solution and wash again and again. So and other medicine, Kirozot is also very good medicine for pruritus vulva. Measurium, pruritus vulva due to unhygienic habits and bad clothing, tight clothes, improper use of contraceptives and masturbation. So these are, if the causes are like this, then measurium is the medicine. So if you prescribe the medicine simultaneously, we have to take auxiliary measures. Auxiliary measures are highly essential, and that knowledge is you will get from gynec books and other therapeutic books. Even in our homeopathy, our antiseptic medicines are echinacea, mother tincture, as well as calendula mother tincture. So if you'll wash the part using calendula mother tincture and echinacea mother tincture, it can be prevented. So neat and cleanness is highly essential. Otherwise, it will play the role of maintaining cause. So after neat and cleanness, then you have to prescribe the medicine to get a better outcome. Then graphitis, erysipelas or eczema around genitalia with violent itching. If there will be eczema, so yes, graphitis is not the medicine for eczema only. For eczema, graphitis is not the only the medicine. There must be some graphitis is the medicine for menopausal age. So if the lady in menopausal age suffering from pruritus vulva, having habitual constipation, delayed menstruation, liquoria gushes day and night, there is sensation of cobweb in the head. So these are all symptoms. If you are getting, then you can prescribe graphitis. Otherwise, you have to think about other medicine. And graphitis eczema is specific eczema where there is oozing, and that is sticky and stingy. If there will be sticky stingy discharge, then we have to prescribe graphitis. Apart from other symptoms, but mental symptom must be there. Menopausal, that is the menopausal medicine like lachesis, like natromur. So graphitis and the medicine must be given in proper dose. I have prescribed graphitis to a lady and there was overdose. So though the lady gets relaxed from itching, but the part, the affected part increases in size. So the lady come to me and blame me that after taking your medicine, the size increases. The eczema size that was increases. Then I counsel them whether there is any relaxation anywhere else. Yes, sir, there the itching is less there, the discharge is less there, but the size increases. Then I could able to understand that this is homeopathic aggravation, and as it is intolerable, so I prescribe 1 dose of arsenic because the antidote of arsenic, that is graphitis is arsenic. So after prescribing 1 dose of arsenic, day by day there was healing and completely it cures. So proper dose potency must be required, and we have having the knowledge of drug relationship by which you can wherever it is necessary you can give the complement, wherever it is necessary you can give the anti-miasmatic or intercurrent medicines. So this knowledge we should have. Apart from that, we should have thorough knowledge about gynec and obstetrics also. Then cervitis, cervicitis, Marksal chronic cervicitis due to suppressed sexually transmitted infections. You know, Marksal is antiseptic medicine. If there will be syphilis, so we know in where primary manifestation of syphilis is there, because of impure cohesion, then it appears in the vulva or pudenda in form of chancre. If the chancre will be not treated properly by proper medicine, Marksal, then it will be converted to BIBHU. So this knowledge we should have with us, and proper medicine should be given in proper potency. Then it can be treated properly. If it will be suppressed by by injecting higher antibiotics, then again after some years the adverse report, the suppression comes in dangerous form. So it will cause destruction in secondary manifestation, we all know. So in secondary manifestation, psychotic miasm, if there be in case of gonorrhea, then what will be happen? Then the adverse effect of gonorrhea will appear after some days in form of fibroid. So deeper organs will be affected. So suppression should not be there. Proper medication should be there in proper potency, and auxiliary measures must be maintained. Of course, we can apply ointment, we can apply external application for soothing purpose. Non-medicated application like coconut oil can be given for soothing purpose. We should not apply any medicated ointment. Graphitis, cantharitis like ointment should not be given. Sulfur ointment should not be given. It will lead suppression, and suppression is always dangerous than any treatment. So it will destroy case. Then pregnancy and postmortem. So for pregnancy, we have having good medicines from beginning from first trimester to last trimester. In first trimester, because of the what I am telling, the foreign proteins, the hormones, new hormones secreted, the lady is not acquainted. So in first pregnancy, primi gravida, the vomiting is more. That is, in some cases, it is called hyperemesis gravidum. So there are so medicine, but we should know the specific medicine to control. That is, for example, I am giving the name of the medicine Symphorecarpus racemosa. So in Boric Mathematica, it has been clearly mentioned about Symphorecarpus racemosa, that is the medicine for hyperemesis gravidum. Yes, for vomiting, there are so many medicine. Antimcat is the medicine, arsenic is the medicine, colchicum is the medicine. So there are ipecac is the medicine. So, but the symptom must be one side. If there will be glary mucus, more nausea, dry tongue, clean tongue, then ipecac is indicated. But specific medicine is Symphorecarpus racemosa. If the symptoms are, if there be inhaling of cooking fat, there is tendency of vomiting, arsenic is the medicine. So we should have thorough knowledge to prevent the, yes, tocophobia. During pregnancy, there is tendency to eat more. So nitric acid is the medicine. So this should be the proper knowledge should be there, and proper care should be taken, and counseling is highly essential in in case of antenatal care. This is the main problem, that is morning sickness. So this should be properly treated, and in some cases what happens, that is less, what I am telling, appetite becomes less, and there will be flickering of the breast in 3 months, and sleep disturb. So we should not prescribe any type of tranquilizer. We should to get good sleep. Simple medicine, homeopathic medicine is very effective. That is Avena sativa. Yes, but every medicine should be administered carefully. Apart from the proper vaccination, in second trimester, we have to, if the position of the baby is not proper, pulsatilla is a very good medicine. In case, even if you are giving pulsatilla, then the breech presentation can be come to normal position. So this is the miracle of the homeopathy. And if there is a history of abortion, then you have to give the medicine priorly, by which it can be prevented. Then during pregnancy, if there will be constipation, cholinsonia is the medicine. During pregnancy, if piles appear, then cholinsonia, again that is the medicine to prevent piles. So again, to prepare the mother for pregnancy, for delivery, you can, to reduce the fear, you can prescribe aconite, fear of death. Then after pain, the medicine is arnica montana. So, and if there will be placenta previa, then your medicine is what I'm saying, savannah is there. If there will be delayed expulsion of placenta, then the medicine savannah is there. Even in case of dead fetus, the savannah is also very good medicines. So we have having so many medicines with us, but we should know about the pathophysiology, what is happening, why this medicine I am prescribing. If the lady is suffering from dangerous disease like eclampsia, preeclampsia, we should not take risk. We have having medicine, but we should not take risk. We have to refer the patient to proper gynecologist or obstetrician, and then the medicine can be prescribed after proper guideline of by the doctors. So these are some management of problems, hormonal problems or hormonal balance between the, what I am telling, from puberty to menopause. So there are so many medicines, and the pathophysiology, it will correlate pathophysiology with these hormonal changes and physical changes. Then we have having so many medicines, but my suggestion, we have thorough knowledge about the diseases of the woman, about the hormones which are secreted, and which hormone is for which purpose. For example, prolactin, that is for milk secretion. So prolactin for milk secretion, our Ricinus communis is the medicine. So if you prescribe Ricinus communis, then it will stimulate the prolactin from pituitary and the milk secretion increases. Yes, there are so many medicine for this purpose. It's even some skin problems which appear. For example, strap, yes, silvery linings. So these are the problems which appear. Homeopathically, we can treat it by applying external medicines, and mouth in pregnancy, there is offensive smell from mouth. You can give calendula. Calendula water can be gargled to prevent pyorrhea and bad smell from the mouth. So these are different medicines in different phases of reproductive age, from puberty to menopause, and that can be systematically, radically, and treated or managed by homeopathic medicine. So this is about the a role of homeopathic medicine from puberty to menopause. Thank you very much.
Thank you, sir. It was a very informative session. Excellent. You was correlating everything with the cardinals of homeopathy. And I think we need to have another experiential session also with cases and all. I think we can add more if you are ready, and in the next session. IFPH will be very glad to get more from you. And it's time to conclude. So I think a lot of persons will be here also with interact with you. So the time is
Most
limited.
welcome, sir.
Yeah, let's make it in another session, isn't it right, sir?
Actually, sir, to explain about different cases, it needs time. Time is a big factor. So,
Yeah. So in the next session, if we can plan to add more, it will be good. We can make it more.
yes, sir, you are most welcome. It will be my pleasure, sir.
Yeah, please, sir. So
Thank you, sir.
on behalf of IFPH, I thank you for this wonderful session. And here with us is Dr. Ram Pravesh, sir. He need to speak something to you. So you can.
Thank you, Dr. Bindu, sir, and congratulations, Dr. BIBHU Panda, sir. Very nice, excellent session. Bowens remedy and hormonal disbalance, puberty to menopause. Many kinds of medicine, the borax and lactation medicine. Very good listeners, and so very thanks, Dr. BIBHU sir, behalf of IFPH. Very thanks.
Thank you, Doctor. Once again, I thank you, Doctor, for this wonderful session. And I thank everybody who was presented here for the session. And it's time to conclude and over to Malayalam. And in Malayalam also, there's a wonderful session going to happen connected with women's disorders. And over to Dr. Shaila for moderation. Thank you.
Thank you, Bindu sir, and all the executives of
Thank you.
Indian Forum, sir. Thank you.